Good morning. So I hope you're all very well. This week's video, I wanted to do a little bit more details, tips and tricks on cystic acne. And a lot of the time you'll hear a word androgenic acne. So we're going to discuss what that means. And if you're getting cysts, particularly if it's androgenic, it's related to your hormones, particularly your body's ability to metabolize the male hormones as we commonly understand them as. However, men and women have both testosterone and androgens. We all cycle, they're just different dosages. But unfortunately, they're not eliminating so fantastically through the liver, and that's why we'll often see the cysts. So when I say cysts, it means that they'll be painful. So if you think of this as a follicle, it's rupturing at the base of the follicle, so it's filling up with sort of the sebum, the oil and the bacteria, and now it's getting infected, so then the body sends inflammation. So putting pressure on it up here is just going to aggravate the problem. So we need to actually disinfect it. And the reason why often people see it in patterns, so they'll see it in that pattern around the chin or beard area and ovaries here, sometimes around the mouth as well. So they're not a bad thing as much as they're painful and they're visually upsetting. They are a bit like a text message that the organs and the blood is sending up to your mind to tell you that something is either malnourished or not detoxifying very efficiently. And the skin's factory down in the base membrane of it, down here, needs more vitamin A to regulate and heal. This is really interesting. A lot of people say, oh, I keep seeing it reoccurring in the same area, like exactly on the same spot. And that makes complete sense, because once it's ruptured in here, it's a bit like an injury in a muscle. So when you, let's say you've hurt your calf muscle and then, you know, you stop using it and it sort of, the pain goes away, but then you use it again, the pain comes back. Because the area it's indicating that the area hasn't healed. It's no longer healthy. You need to address it. The same here. So once that follicle's ruptured, once the oil, so if there's a river of oil here, once that bacteria builds up again, it's going to rupture the same area. So until we actually go through the treatment and home care strategy to heal down here and fix the actual hormone that's causing it, it's a constant battle. So the great news is there's lots of simple, effective ways to address this. So androgenic acne is not just for the teenager anymore. It's quite common in adults, and it is a blessing because it's your body way of saying that, again, it's like an emoji. It's sending you a little visual cue. Our skin and our body doesn't communicate in words. It communicates in symptoms. So it's our job to listen and to actually play detective and go, okay, what's going on? So what causes it? Vitamin A deficiency. So if you want to start addressing it really quickly because it's visually unhappy and it's painful, you want to boost your retinol stores in your blood. The quickest way to do that is in a form of an animal liver. So organic beef liver is my chosen option. I take it in a pre-digested or dehydrated capsule form. So 5 of these capsules is worth about a palm size of the meat. And that's a really good idea for swapping out the protein and fat content of your breakfast. So this is real food, it's just convenient. You can also buy organic liver and prepare it every day. But I see this works so easily on clients. So retinol is going to address the deficiency in the blood, which is going to help the liver, the gut, and then support basically the oil. Control the oil glands in the base of the skin. So that's why we look at that. Another internal thing you need to understand what the skin's telling you is your minerals are too low in your blood. So minerals, this is an idea. I like this one myself, but they should be obviously checked on your symptoms before we prescribe. So this is a magnesium, zinc, multivitamin powder that can be taken in water. And there's lots of beautiful ingredients as well. The reason I like this one for acne a lot, it's got taurine. So a lot of this acne is also triggered through the mind's perception to kind of life, multitasking stresses. We know the skin's very rich in nerves, so the brain can send cortisol, which will also affect it. So that kind of helps to address, again, the blood level of it. The gut is also a big reason why we get cystic acne. So the lining of the gut can be impaired, and the liver and the gut aren't detoxifying so well. So sometimes we need to do a course on something to improve the lining and the elimination pathways of the gut and liver. So this is another idea. So this has a lot of A again, it has D, which is great for your mental health, but it has also glutamine. So glutamine is a little bit like putty. So if you eat, let's say, a little bit of wheat gets into your diet, or sugars, or pesticides and chemicals, unfortunately they can cause little holes in the lining of the gut, and now we get a lot of inflammation, reflex. So when we eat healthy food, it goes in there, but it's not being contained, it's absorbing through those permeable holes, and now we've got this inflammation loop. So with acne, we want to really address the gut, because it is that the message is coming that area needs support. And it's pretty common in the adult sector that area needs support. With the teenage sector, we know that oil glands are twice the size of an adult. That's just the joy of puberty. So we're trying to contain it topically and internally. And obviously we do the same for an adult, but we know the adult has had a lot more mileage, just like a car. So often that gut needs more servicing. So that's why we need to address these areas. PMS for women, the symptoms, they think it's normal, but it shouldn't happen. If you're getting PMS, it tells me that these systems are out of whack and they need to be addressed if you want the skin to come down. I see with clients that are naturally geared to be an oily skin, as soon as we sort out these systems, the oil becomes normalized. And if your skin's oily, you're going to notice you're going to get pores. The pores are going to become open, and the texture becomes more rough, and it's not smooth, it's not pretty. So as soon as I get them into balance, if they're going out of balance, it's usually something in the internals that are out of whack, or topically they're not absorbing enough vitamin A. So we might need to make sure that their dose is correct, that they're applying topically, or their delivery of that vitamin A is correct. Because another interesting thing, it's a little bit like fitness. When you start using active ingredients that the body goes, awesome, this has given me the ability to make you more waterproof, more protected, more on task for basically reducing the stress of corrosion from the environment. So all the ability to reverse damaged DNA and heal all the health problems in the skin. It also makes the skin more waterproof, so it makes it more resistant to absorbing it. So once you get through that first sort of beginner phase, you kind of can plateau out, and we don't want to use that as an excuse to kind of maintain cell. We want to keep changing skin. We want to keep making it younger and stronger and making the most every time you apply skincare. We don't want it to be sitting on top. We want it to be getting in. So that's why we have to keep looking at ways to manipulate the skin. So sometimes it's using home rollers, sometimes it's how we treat it with cool peels or special types of treatments, medical needling, home DF devices. These are all advanced tools, but they are weapons when you want to make maximum physical change in tissue. Because once you plateau out, it just moves you on to the next level. And I'm not sure where it will go, because my skin keeps improving as I get older. So that's kind of the goal, right? The last thing I want to address with PMS symptoms is there's really three things the three pillars. If you're seeing cystic acne, it's androgenic. So obviously your minerals, vitamin A, want to make sure the liver's working. I also encourage you guys to listen to the podcasts I've been sharing on glucose spiking. There's lots of lifestyle hacks. Her name's the Glucose Goddess. She's got it's a cool, easy to understand lifestyle hacks that will complement these supplements to keep the glucose spiking down, which will slow down the aging process called glycation, but it also helps cystic acne. The last one is this little chestnut. Wild yam cream is not a hormone, it's just herbs. herbal medicine has an ability to be concentrated food, and this one targets hormone function. So both men and women benefit from this, but especially if you are seeing cystic acne, you want to be using about a finger dip to here and applying it to the décolletage is really cool because I've seen some nice anti-aging benefits. So I just applied here twice a day, and I line it up next to my vitamins, so it just sits there and I put it on. If you're menstruating, your hormones are flatlining, so you don't have to use it then. However, I have found for some personalities, if you're not very good at getting back on board, you just need a habituary process and not think, just keep going. You'll only benefit from it. So recapping, we want to make sure if you're getting symptoms that you're talking to me and tell me what they are so we can tweak. So often it's that tweaking that will make the biggest change. Learn about glucose spiking. Make sure orally you're getting enough retinol into your bloodstream. Vitamin zinc or mineral, zinc and magnesium. So think about your gut lining and the gut health. And wild yam cream is not going to hurt anyone. The only contraindication for that is if you are on contraception as far as the menstrual, like the pill or something, because if you're shutting off the system from functioning, there's no point supporting it. It's shut down by that kind of pharmaceutical. So we kind of figure out other ways to support you. And you will be surprised how much those cystic pimples go away. But it takes time, and often if you fix the root of the problem with these strategies, you'll get really happy because your whole body will hum and thank you for it. So that's what it's about. A symptom is actually your body's way of asking for a little bit of support, a little bit of love. And what's the definition of insanity? I think it's repeating the same process and expecting a different outcome. So we want to tweak, we want to adjust. We never want to just keep doing the same thing. I've been there. I've done it many years in a row where I've kept going on a certain path thinking it's going to work, it's going to work, it's just time. But it's not working. So I have to really stop, reevaluate, make some lifestyle changes, and then my body starts doing what I wanted it to do. Funny that. So anyway, that's a little bit about androgenic acne, something to consider, and hopefully a little bit of motivation. All right, have a fantastic day and talk soon.